I'm Dr. Matea Polisoto. I'm a naturopathic doctor in the Los Angeles area. And in this video, I want to talk to you about how to dissolve lumps, bumps, any kind of growth or tumor in the body. Yes, it's possible to do this with natural healing methods. And I first became interested in this when I was early on in my training. It was like 2004. I was studying in our rare book room library, and I was reading the cases of Dr. John Bastyr. He's a famous naturopath. He started his career in 1936 and practiced for 50 years. And as I was reading his cases, it was like this: cure of tuberculosis, cure of pneumonia, cure of acne, and there was one that said resorption of a breast tumor. And I thought, resorption? Who uses that word even? And I read it and I said, wow, this medicine is being lost. And I was feeling at times disappointed with some of the approach of the doctors I had to study with, because a lot of naturopathy or holistic doctors, you go to see them, they recommend a bunch of supplements, you go home with a bunch of supplements, but nothing really changes much. So I had taken a leave of absence from school, and I had studied with some excellent doctors, and I had actually studied lymphatics, how to diagnose lymph problems and how to treat them using lymphatic massage and different equipment, because it was so powerful for my own healing. And it was interesting because there was a conflict among my teachers. In school, we had a class where the teacher said that with someone with cancer, you shouldn't apply heat or massage to the person. And as I read Dr. Bastyr's cases, he was taking patients with cancer and putting them in body bags and putting hot rocks in there and zipping it up and letting them steam with the heat. So I thought, wow, there's such a different approach, and people often find that. But later on in my training, I finally worked with a doctor who was getting incredible results and seeing growths in the body dissolve naturally. But it was with cleansing. When I started off my practice, I didn't work in an office seeing people on an outpatient basis. I worked at a retreat center where people could come and they were truly cleansing. Naturopathic medicine is really two things. We believe there's two reasons people get sick. They're deficient in some important nutrient, or you're toxic in the body and some organs are toxic. So in a retreat setting where you have your diet is completely controlled, you're on a strict diet, we do yoga, infrared sauna, massage, sometimes IV therapy, different therapies, exercise, getting sunlight. You can really transform your body because you do that consistently over time. The body can heal itself. So this was really, really interesting to me. But when I started doing that kind of cleansing, I found people who all kinds of lumps and bumps and growths would go away in their body. It was a lot of hard work, and it's hard to, I'm not going to lie, it's hard to facilitate because there's so many pieces to put together when you do a retreat. So retreat settings are great. But then I went and moved into an office situation, I thought, how am I going to get as good of results with my patients? And I had a gentleman come to me who had a tumor on his neck. And it wasn't like jutting out, it was very flat, but it was very, very hard. And I thought, my experience was that it takes about 6 to 9 months of really strict cleansing to dissolve something like that. But my favorite tool that I really emphasize in my practice is essential oils and aromatherapy. So on top of all the things that I learned, I added that to the regime. And we actually did what's called a poultice. A poultice is a pack that you apply to the skin to try to draw out some toxins or a mass. And there's lots of different types of poultices you could do. Potatoes, different foods are used that actually draw, or clay can pull out toxins. But I used essential oils, and I took just a piece of gauze, and we put some really concentrated essential oils on it. And then you take what's called Tegaderm. We normally use that for IV therapy. So you just put this on the spot, and then you put this over it to seal it, because essential oils will evaporate out normally when you apply them to the skin. Some absorbs in, but some evaporates. And so we sealed it and did 1-hour treatments. And then I just made a balm. Like, this is all my favorite lymphatic oils in a kind of like a serum, a lotion. And so we had them put it on that every day. And in 1 week, the tumor had dissolved. And I was completely shocked. I didn't expect that to happen. And then he had a CT scan 3 weeks later, and there was no traces of any cancer in his neck. and in his body. So that was a really dramatic example. But it's interesting because most people just don't believe it's possible. I just hear that over and over again, that people are really shocked. They just think their only option is to cut and remove something in the body that doesn't belong there. But the body will there's only two things that can happen if you go on the healing journey, is that a mass, even as it's either going to pop out and release the toxins, or it'll resorb them into the body. But the body will not resorb them into the body unless the bloodstream and the organs can handle that toxic load. So you have to make sure the bloodstream is pure, and you have to open the organs of elimination and detox. And then the body, it's very intelligent, it will resorb that mass. But I want to talk to you about what creates this problem in the first place, because it's years in the making. It's not something that happens overnight. So my question to you is that we want to ask your body, and you ask yourself, do you have a proliferative pattern going on? So that's what I was kind of talking, that there's a pattern in the body. I call it a proliferative pattern, where things are growing, which shouldn't be growing. So this, you can get lumps, bumps, growths, and tumors, and they can manifest as acne, lipomas, moles, cysts, fibroids, cherry hemangiomas, they're little red bumps, and tumors, which can either be benign or malignant. So all these we think of as the same kind of pattern that's going on in the body. And I want to talk to you about what the cause is, because no one ever asks what the cause is. They just cut it out. But the problem is, you can cut things out, is if you don't change the cause, they come back. And I see this all the time. People have a boil on their butt, or they have a lipoma. They cut it out, it comes back again and back again. And you start cutting and cutting, and then there's chunks of your body missing. And most of the time that they do not grow back that tissue. So one of the causes is estrogen dominance. It's very common now in men as well as women, men having too much estrogen, but women will have too much estrogen and too little progesterone, or normal estrogen and too low progesterone, so the ratio is off. And this causes a proliferative pattern where tissue will grow. And this causes heavy bleeding and fibroids, especially uterine fibroids, fibrocystic breasts, and it's a pattern. But this pattern can be changed and it can be healed. But that's one of the things we look for. Excess acidity in the body. The body has a buffering system to deal with excess acids. But if it's overloaded through the foods and drinks that we eat being too acidic, the body's system of alkalinizing is overburdened, and there's too much acid in the body, and acid accumulates, and then it will form a lump or growth. And that's one of the causes. Also, just poor elimination in general. If waste material, if excess acids are not released, they'll accumulate. So poor elimination through our bowels, through your kidneys and urination, through your sweating, through your lymphatic system. And liver toxicity usually is a big part of that. Toxins go out of the body through the liver and then the bowels. So if your liver is toxic, in general, when I see people that are liver toxic, they will have an increased number of moles as they age, brown spots, and cherry hemangiomas, and lumps and growths. So how do we check this? How do we test this in your body? We're missing one. Oh, well, before we talk about that, the really amazing thing I learned is a different perspective of how to approach lumps in the body, is that it's simply stage 5 of over-acidification. So when people are younger and they eat acidic foods, they just eliminate it. But as people get older, what happens? The metabolism gets sluggish and your elimination is not as good. But so my job as a naturopath, when I evaluate your health, is to figure out what stage are you in. And the good thing is this can be reversed through a change in lifestyle. So the first stage of acidity is you're tired, you get sluggish. Then people get sensitivities, allergies, and irritation. And the good thing about this is if you alkalinize, those go away without taking anything. Then if it progresses, people form mucus. When you eat something acidic, the body makes mucus to try to buffer the acidity of that food so it doesn't inflame the tissues. But if that gets overloaded, then you get inflammation, which is redness and swelling. And most people can attest to that. I don't drink, but after people drink or they eat really toxic food, the next day their skin will feel itchy, it'll be red, more swelling, overall more swelling and bloating. And then stage 5 is the accumulation of those acids and those metabolic wastes that are not getting eliminated harden. That's what induration is. And that's where you see those lumps and growths. And if that still is not addressed and changed, then the tissue starts to ulcerate, and then you get degenerative illnesses like cancer, MS, osteoporosis, Parkinson's disease. So it's a progression, but the empowering thing about looking at the body in this way is that when there's a tumor or even infection, there's nothing outside attacking you. You're actually making it from the inside out because of toxicity. So we assess this by doing hormone testing. I'm amazed a lot of people, once a year you should get a wellness panel. Just checking like blood sugar, make sure you're not getting diabetes, electrolytes, liver and kidney function. But a lot of people don't test hormones. They don't test them comprehensively. And you can get a blood test, but there's actually urine and saliva tests that you can do at home. And going back to estrogen dominance, there's actually a urine test which checks the different metabolites of estrogen. Certain ones are thought to be more indicative of leading to cancer, and other ones are more healthy, kind of like the good and bad cholesterol. And it's a very useful test to look at, and you can do that at home. And then acidity is really easy to test. You can get little pH strips. You just, the saliva you can test, but that's not as important as the urine. The urine reflects your tissues. But you can check them and see what level that you should be at. And the urine should be 7.365 or 7.4, right around there, reflective of the blood. If there's too much acidity in the body, the pH will go down and look more yellow or orange. And it's a very simple philosophy. If you keep your pH below 7 in the 5 to 6 range, between 5 and 6, whatever lumps or growths are in your body are going to grow. If you raise the pH, they will shrink and dissolve. And when I learned that just changed my entire practice. And it's so simple. It's not easy to follow, but for those of you that are willing to change, that want to live a healthy diet, healthy lifestyle, that want to change your diet, that are kind of tired of, living that life where you're not eating right, it's going to catch up with you at some point. If you're willing to change, if you're willing to try a different approach to lifestyle, you can see all those inflammatory symptoms reverse themselves and go away. Now, pore elimination. Most people have some toxicity in their bowels and they don't know it, and doctors don't talk about it. In fact, I tell people you're supposed to have 2 to 3 bowel movements per day, and they say, "You mean per week?" They just don't. They're really shocked. No one ever talked to them about this, and doctors don't treat constipation until it gets really severe. I have people that will miss days, and that creates a lot of toxicity in the body. And nobody talks to people about what the signs and symptoms are. Bad breath and foul-smelling gas or bowel movements are the first sign. And that's actually not a good sign. It's a really important thing to address and to treat it. I really coach all my patients on this. People think it's normal. I always joke and say, it's not normal to go to the bathroom and turn the fan on, shut the door, and say, "Wait, don't anybody go in there." So many people have that experience, but they don't realize that that's not normal. There's a saying called "death starts in the colon," and I think that's so true. It's a really true statement. But there's 2 tests that I use to check bowel toxicity. One is called the Indican test. I started doing that in 1993. I'm a biochemist as my undergraduate, and I worked in a doctor's office where we actually did this in the office, and it was kind of like checking to see where people are at. I think we get a rating 1 to 10, and anything over 5 is really toxic bowels. You can still get this test done. I don't do it as much, but there's also what's called a comprehensive digestive stool analysis. And this checks, are you digesting your food? Do you have bacteria or yeast or fungus in the stools that shouldn't be there in your intestinal tract? Do you have the right good bacteria that you need? It checks for a lot of information that we can see. And so these give you a baseline idea of what's out of balance in the body and then how to treat it and where to address it. So it's a very useful information. So then how do you heal the situation? Well, for healing estrogen dominance, the first thing you have to do is decrease your meat intake. I've just seen it over and over again. As soon as people cut down on their meat, they bleed less and they have less PMS, and especially women, and less problems with hormone imbalance. And I think part of that is a lot of the meat people eat is given hormones and antibiotics. And so that's an issue. Decreased sugar, I absolutely see. I mean, everyone knows they shouldn't eat a lot of sugar, but I definitely see an improvement in hormone levels when you decrease sugar. And sugar just causes inflammation. Also, microwaving your food makes the body more like estrogenic, especially men. I mean, a lot of men I see are having accumulation of fat around their breast tissue, and they're very uncomfortable with that. Even men who are muscular. And one of the first things I do is tell them you have to stop microwaving your food, even your leftovers. I will never heat my leftovers. In fact, I took the microwave out of the kitchen when I moved in. I either heat it on the stove, a steamer, or in the oven. We just do not use the microwave. But also, the main thing you have to do is increase your vegetables, which increases your fiber. It helps the hormone balance. The other thing you can take for hormone balance is DIM. And this is actually the substance in broccoli that is isolated and concentrated. And I've seen this definitely help women, especially with their hormone balance. And liver herbs, because again, hormones are made by cholesterol, which is manufactured and processed and distributed with the liver involvement. The liver is a big part of your hormone imbalance, which a naturopathic approach is to treat the liver. Conventional doctors don't correlate the two. So I always give liver herbs when I'm trying to balance hormones or heal any kind of lumps, bumps, or cysts in the body. So my favorite herbs are burdock, dandelion root, gentian, and milk thistle. So I custom blend people their own tincture so I can kind of make you your own formula, but you can go get these herbs. I always use the liquids first because they're more powerful. You can use teas, but some of them taste really bad. So there's many ways to take them, but they will help your liver to process toxins. And then how do you heal the over-acidity? Well, you have to know which foods are acidic, and we have food charts for that. And then I coach people on how to do the diet and how to find recipes and ways to make it work. But mainly, all the foods that are acidic are ones people usually love the most: meat, dairy, wheat, and sugar, fried foods. Those are very acidic. All the vegetables we eat all vegetables except white potatoes, mushroom, and corn. But all the other vegetables are alkaline. So it's basically just, you need to double and triple your vegetable intake. Also decreasing acidic liquids. A lot of people don't realize how acidic things like Perrier and carbonated beverages are, how acidic coffee is, and alcohol. So you have to cut down on those. Again, increase the vegetables, but also increasing chlorophyll. Just taking liquid chlorophyll or green juice will raise the alkalinity of the body. And also, some people, you'll really need to work on being more calm and reducing your stress, because stress can make acidity just from your mind having worrisome, fearful, or negative thoughts. And so how do you heal pore elimination? There's 4 ways the body gets rid of acids, metabolic acids, and waste in the body. We get rid of toxins from urination, defecation, perspiration, and respiration. So urination, the first thing you have to do is hydrate more. It should be 1 liter for every 30 to 50 pounds of body weight. So that's about a gallon a day for adults. Your kidneys are really important to getting toxins out of the bloodstream. I tell people, especially I coach a lot of people who are on camera and they have acne and skin issues, and I say, well, the body's trying to get rid of toxins and it's getting it out here because it's not getting it out other places where it should be. So you just think of traffic jam. Like if we route the traffic through the right route, they won't come out on the skin. So the first thing, everyone knows and has heard this, but I really want people to think about it, that like, I tell people, if you asked your cleaning lady or if you wanted to mop your kitchen floor, but someone just gave you 1 glass of water, could you even remotely get the floor clean? Like, no. Well, your body's constantly needs to clean itself and to flush out toxins, but we don't give it any water to flush out the body and the kidneys. The kidneys is a filter. It needs to be cleaned. Again, bowel movements, 2 to 3 per day. We use fiber and eating more vegetables. And then I formulated, it's called Dr. Matea's Poop Pills. It's really popular. I tried most all of the products in the health food store for cleansing the bowels, and I found them to be too intense, making you have urgency, and I just didn't like them. So I found this herb, Cape aloe from South Africa. It's really an amazing plant that I formulated in 3 different strengths for people to help them make sure they're eliminating regularly. But there's a lot of products out there that you can try. Perspiration. Oh, yeah. Perspiration. Sweating is so important to detoxification. Our bodies are meant to move every day and to sweat every day. A lot of people who have skin problems, acne or lumps or growths are sedentary. And some people are sick and they can't exercise, but cleansing the lymph is paramount to getting well. And we have to treat the spleen. Spleen is really involved in the lymphatic system. The way we know a person has a problem with their spleen is their tongue will have ridges on it and be a little swollen. Because when you go to bed at night, the tongue swells and presses against the teeth. So I always look at people's tongue to determine what's going on there. And we have to sweat daily. So I send people to the sauna, especially infrared sauna is the best. Or we have them take Epsom salt baths and also lymphatic massage. And then respiration, I'm going to do a whole nother video on how to cleanse your lungs. So there's many types of cleanses and way to detox the body. There's kidney cleanse, lung cleanse, liver cleanse, bowel cleanse. There's all these types of cleanses, and people really need some guidance on how to do this. So I'm really wanting to give you an overview of one, knowing that it's possible, that you can see an improvement in your skin and whatever's going on, whether it's acne, bumps, growths, and even tumors in the body. There are natural therapies, but it's a whole body problem. It's a systemic problem, and it has to be treated that way. So if you cleanse and purify the body, the skin rejuvenates itself, and the body can resorb whatever's there that shouldn't be there. But it generally takes about 3 months to do this of consistent eating. That's what I kind of picture I like to paint for people. But if you like this idea, this approach, and it's stimulated some curiosity in you and you're interested in following this approach, join me. I'm going to be coaching people on my membership site and teaching online every week, teaching strategies, how to do this, actually how to put it into action and create a protocol for yourself, what to eat, how to prepare the foods, learning about herbs and essential oils, how to use them to keep you and your family healthy. So I'm really excited to be with you. I want you to join me, and I look forward to coaching you and helping you be in the best health possible.